Hello, happy people. This is Dr. Sandra Brown back again, talking about managing high eyes. Part 2, the number one mistake you make treating high eyes. And this information is brought to you by the Dry Eye Foundation. So, at the end of part 1, I brought up the issue that some of you might ask yourself, why are my eyes red again? And the most common cause for this is a condition called rebound. What causes rebound to happen? Well, on the left, you've got your high eyes. You use a lovely vasoconstrictor redness relief eye drop, and on the right, your eye is beautiful and white, and you're good to go for that dinner with your boyfriend's parents. If you use those redness drops too often, in other words, if there is overuse, then what happens is that when the drop wears off, the redness comes back rapidly, and it might even be worse than before you use that eye drop. This is called rebound. So if you're asking yourself, why are my eyes red again 3 to 4 hours after using that redness relief eye drop, you are experiencing rebound. Now, if you're asking yourself a related question, which is why are my eyes still red, you are developing tolerance. Tolerance happens when you've used those eye drops so frequently that they're basically not working anymore, or working for an incredibly brief period of time. Maybe 15 to 20 minutes, when the bottle says you're supposed to get 8 hours of redness relief. This is what your eye will look like if you use those vasoconstrictor eye drops for a long period of time, very frequently. This can lead to permanent dilation of the blood vessels on the front surface of the eye, making you look like Darth Maul. At some point, those vasoconstrictor eye drops are going to do absolutely nothing. Your blood vessels have remodeled and become permanently larger. And this is permanently how you'll look. It doesn't happen often, but it absolutely can happen. I've seen several patients like this, and there's really not much I can do for them. The Dry Eye Foundation does not want you to look like this. So please, keep listening. And oh yes, Google says rebound is a problem. I searched high eyes rebound, and I got about 35 million hits. What are the symptoms of eye drop rebound intolerance? I've already discussed a few, but just to reemphasize. Number 1, your eyes look redder after the eye drops wear off than before you use them. That's rebound. Number 2, the eye drops work for shorter and shorter periods of time. That's tolerance. Here's a couple practical tips. If you haven't used cannabis for more than 12 hours and you look at yourself and you feel like you need to use an eye drop, you're probably experiencing rebound. Because by then, the THC should be out of your system. THC is what's causing those blood vessels to dilate. When they dilate, which is to say enlarge, that's when your eyes look red. When the THC is gone, your blood vessels should go back to their normal size. If they aren't, you've got a problem. Another practical tip is this. If you enjoyed some cannabis the evening before and used a redness relief eye drop, and then you take a look at your face in the morning and you're like, oh man, I got to use that redness relief eye drop again, you are heading towards rebound and tolerance. Once again, same reason, the THC should be out of your system. What are these magic ingredients in vasoconstrictor red eye drops? The most modern ingredient is brimonidine, 0.025%. Stay with me while I read these because it is important later. Then there's nafazolone, comes in 2 concentrations, 0.03%, and a milder concentration, 0.012%. There's a single product which contains phenylephrine, 0.02%, and then tetrahydrozoline, 0.05%. I have these listed in alphabetical order, not in order of easiest to find or most powerful. These are the eye drops that can definitely cause rebound and tolerance if you overuse them. Anything that contains nafazolone, 0.03%, and anything that contains tetrahydrozoline, 0.05%. I'm not going to read the name of every single eye drop on this list, but if you're watching this video as opposed to casually listening to it while you do something else, like Candy Crush, you should stop what you're doing and read this list. Just to throw out some names for you though, the Roto products, Clear Eyes, Bausch & Lomb, Visine, and Equate, which, according to my research, are all favorites of cannabis enjoyers, are on this list. For additional resources and support, please see these web pages. And stay tuned for part 3.